Hi, my name is Dr. Erin Schott, and I'm a pelvic floor physical therapist for the Rehab Guru here in Omaha, Nebraska. And today I'm talking about erectile dysfunction. And one of the reasons that we tend to see patients for erectile dysfunction actually has to do with a lot of other medical conditions. Some of them are high blood pressure, high cholesterol, diabetes, prostatitis, and we treat the component of erectile function, which it's a very complex process, right? It involves the brain, the hormones, muscles, nerve, and most importantly, blood flow, which tends to be what we function and focus on the most in PT. We use modalities to help with that, particularly shockwave and also exercises in conjunction with medication that you may be taking that your doctor has prescribed. We also address any other contributing factors that may be happening at the spinal level if you're having back issues that may be contributing, and educating and helping support you through risk factor elimination or decrease that could be contributing to a lot of the symptoms that you're experiencing.